Tourette syndrome, or TS, is a neurological disorder that causes involuntary movements and sounds called tics. These tics can be sudden, repetitive, and hard to control. The condition usually starts in childhood, typically between the ages of 5 and 10, and affects people differently. Some individuals have mild tics that barely interfere with daily life, while others experience more severe symptoms. There are two types of tics: motor tics and vocal tics. Motor tics involve uncontrolled movements, such as blinking, shrugging, head jerking, or facial grimacing. Vocal tics involve sounds or words, such as throat clearing, humming, sniffing, or even repeating words. Some people may experience complex tics, like jumping, touching objects, or saying inappropriate words, though this is less common. The exact cause of Tourette syndrome is unknown, but genetics play a role, meaning it can run in families. Researchers believe it is linked to differences in brain chemicals, especially dopamine and serotonin, which affect movement and impulse control. Tourette's is not caused by stress or bad parenting, though stress can make tics worse. Tics often change over time, getting better or worse in different situations. Many people notice that tics get worse when they are excited, anxious, or tired, while they may disappear when they are focused on a task like reading or playing a game. Some individuals can temporarily suppress their tics, but this often leads to discomfort and a stronger tic later. One of the biggest misconceptions about Tourette syndrome is that everyone with TS shouts curse words or inappropriate phrases. This symptom, called coprolalia, actually affects less than 10% of people with Tourette's. The majority of individuals with TS have other, more common tics that do not involve inappropriate speech. Tourette syndrome often comes with other conditions, such as ADHD, OCD, anxiety, or learning difficulties. These can sometimes be more challenging than the tics themselves. For example, a person with Tourette's might also struggle with impulsivity, obsessive thoughts, or difficulty concentrating. There is no cure for Tourette syndrome, but many people find that their tics improve as they get older. In some cases, tics become less noticeable in adulthood. However, for those who need help managing symptoms, there are treatment options. Behavioral therapy, such as CBIT, Comprehensive Behavioral Intervention for Tics, can help individuals gain better control over their tics. In more severe cases, medications that affect brain chemicals may be prescribed. One of the most important things for people with Tourette syndrome is understanding and support. Since tics are involuntary, telling someone to just stop does not help and can even make tics worse. Instead, acceptance and patience can make a huge difference. Many people with Tourette's go on to lead successful lives in careers like sports, music, acting, and science. Some well-known figures with Tourette's include Billie Eilish, Samuel Johnson, and Dan Aykroyd. Awareness and education about Tourette syndrome are key to reducing stigma. Tics are not a choice, and people with TS should not be judged for something they cannot control. The best way to support someone with Tourette's is to be patient, avoid drawing attention to their tics, and focus on their strengths rather than their condition. Understanding that Tourette syndrome is simply a neurological difference, not a flaw, helps create a more accepting and supportive environment for everyone.